Dr. Helfet never accepts defeat. I have seen him work wonders with many patients.
He is a model of who we want as a surgeon at HSS. He's like a surgeon's surgeon.
He is my hero because now I can do everything again.
He saved my life. I'm indebted to him. I always will be.
I was always destined to become an orthopedic surgeon. My dad was a tremendous role model. He was a wonderful human being. He was a great doctor, famous doctor, very family-oriented, and set high standards for all of us. I was very interested in trauma, the more complicated trauma, so I think I just gravitated towards that.
I recruited Dave when I was Surgeon-in-Chief to come up here, and he started here at Special Surgery in 1991. And he built the trauma service to the point where it's nationally and internationally known.
So I was very lucky. I was able to come and was given a carte blanche, really, to develop and build a nationally recognized orthopedic trauma service.
In the busy days, we would see 90 people on a Monday in clinic. People would wait for 3 hours, gladly, for Dr. Helfet.
And Monday, you have patients?
Monday, yes, you have patients all day.
Sometimes they're even from overseas. If it needs to be an urgent case, Dr. Helfet will get that patient there.
Okay, perfect.
It all happened when I was on vacation in France.
I was driving my 1989 Springer Softail Harley-Davidson motorbike.
I lost control of the bicycle and went crashing on my side.
Within the blink of an eye, this deer came up out of the side of the road.
The impact wasn't just a bang and a stop, it seemed to go on forever.
I was like pew, on the ground, like a catapult.
Most of our patients are young, healthy, productive people. So when they wake up, they didn't plan for this, and the next thing they know, their whole lives are turned upside down.
I had broken ribs, a fractured shoulder, some fractured fingers, and worst of all was my hip.
I had broken my pelvis in 2 places, and I was not expected to last the night.
Everyone involved is convinced we have to get Dr. Helfet for this. We have to get Dr. Helfet. He's the one.
When you wear the orthotics, you'll have your arch back. I think the most important thing is, number 1, be realistic. Tell them the truth. 2, tell them that you're going to solve the problem, if you can, and nurture them through the process.
What he does is he reaches over and tells them, it's going to be okay. We're going to get you back to who you are.
And it's the smile as much as anything he says. It was all about that feeling of everything is completely under control. Dr. Helfet's here.
Nice to see you.
He cares about you. He cares about the work he's done on you.
I really think of my job is to restore someone back to where they were before the truck hit them. And if we can do that, then I think we make a huge impact.
6 weeks after Dr. Helfet gave me the all clear, I ran the New York City half marathon. And I'd actually ran it in a better time than I'd done the previous year.
I was really surprised how quickly I could go back on my bike.
One of the chiefs next to me said, what was going on? They said, the building's coming down. I got caught in the periphery of the collapse. I was buried under some debris. And I tried to move. I couldn't move.
As you know, a significant number of firemen lost their lives, as did police in the World Trade Center, 9/11. But there were a few who made it out, and Captain O'Flaherty was one.
I arrived in HSS by EMS right to the front door, and Dr. Helfet was there to meet myself. I had my wife, my one daughter, and I remember saying to him, just do what you think is good for me. That's all. I trust you.
We have a relationship with the medical department, the fire department, and the New York City Police and the state police, and it's an honor and a privilege to take care of them.
Dr. Helfet, there's a little spot in here. It's special, and it's not the implant. It's just that I know you put me back together, and that put me back on the road to healing, not only from the physical part, but from the part that bothers you mentally.
Within 12 hours of the earthquake, David calls me up and he says, we're going to Haiti. And I was on my phone, I remember it to this day, and I said, are you nuts?
I just saw it on television what had happened, and I said, we can help. And everybody I asked to help stepped up to the plate. No one said no. It was unbelievable.
To help people is something I think you're really just born with it. It makes them feel good. It makes them feel like they really made a difference in someone's life. And because he's able to do that, it just gives you a reason to keep doing it.
HSS, it's all about the pursuit of excellence and achieving excellence in all aspects of taking care of patients, teaching, publications, dealing with hospital personnel, and Dave has it all.
He's an important reason why HSS is what it is today. HSS is about excellence and compassion, and David Helfet embodies those principles.
He is obviously a gifted surgeon, but I also think he's just an outstanding human being, and that combination is unbeatable. A lot of people know that Dr. Helfet is very good at fixing bones, but they might not know he's also very good at fixing up people. Dave introduced me to my husband, John.
I think if Dr. Helfet understood how great an effect he had on his patients, he would be unbearable. There is no feeling I've had about anyone who's come into my life, and no one's ever come into my life the way he did.
He's an exemplar of what we should be proud about, what we should aspire to at HSS, and what I'd love to see our young surgeons aspire to become. And so I'm so pleased and proud that he's the recipient of this year's Lifetime Achievement Award.
I really accept this honor on behalf of a lot of people, not just me. Every step of the way, somehow it seems like someone's latched onto me and imparted knowledge or experience or been a role model throughout my life. I've really had a very, very lucky run.